second.
Okay, I started the stream.
Okay.
Right. Hi everyone, welcome to another virtual shadowing session. Today we have our amazing guest, Dr. Zhou, and he will be sharing his journey to dentistry and some interesting cases. So Dr. Zhou, whenever you are ready, you could go ahead and start.
Sure. Hey everyone. First off, sorry for being a little bit late. We finished up with our last patient a little bit late today, so apologize for taking up a little bit of your time. But thank you so much for dropping in today. Thank you so much for Fresh Smiles Shadowers for having me on. Pleasure to be here. So let's just get right into it. So today we'll talk a little bit about my background, how I came to be where I am today as a general dentist. Show you a couple cases of what I do on a day-to-day basis, and then we'll get to kind of what you guys are really all here for, how to best get into dental school and how to survive once you're in there. So a little bit about me. I graduated from BU in 2013. I double majored in bio and economics. My final GPA, my science GPA, you can see on the screen, they weren't the most impressive GPAs, but I was still able to get in dental school on my first shot. So for all of you out there with less than 4.0 GPAs, just know that it's still very possible for you to get into dental school, and still very possible for you to get into a great dental school on your first try. So I went to BU again for dental school. I graduated 2 years ago in 2019, and following dental school, I did a 1-year general practice residency up at St. Barnabas Hospital in the Bronx. So why I chose dentistry as a career, growing up, I was always involved in the healthcare field. My father was a primary care physician. So growing up, I got to spend a lot of time with him in his office and seeing how he treated patients, how patients viewed him, and I came to really love being a healthcare provider. So I knew I wanted to be somewhere in the healthcare industry, and I wanted to do something procedural. I really loved working with my hands growing up, loved playing with Legos, building radios, kind of anything involving, my hands I love to do. So I knew I wanted to do something both in healthcare and working with my hands. And on top of that, one of my biggest dreams in my life is to own a business and own several businesses. And I think dentistry really encounters all three of those very well. It gives you the opportunity to work in healthcare, gives you the opportunity to work with your hands and work with people, and to become a leader in your industry, to own businesses if you are interested in that. So I found that dentistry really wrapped up all of these niche things that I wanted to do with a nice, pretty bow. And I'll be honest, I'm so happy that I made the choice to become a dentist today. In addition to all the things I mentioned, compared to careers such as medicine, it's a relatively short time in training. There's opportunities for lifelong learning new skills, continuously improving yourself. There's a great work-life balance, and there's a high patient value for services, meaning that the services that you provide for your patients are greatly appreciated. So I consider myself a super general practitioner. And what is SuperGP? So a SuperGP is a general dentist that does a little bit of all specialist procedures. So the very basics, all general providers will do restorative work, so fillings and crowns. But we'll also do things such as root canals. I do my own extractions, I do surgery, I place dental implants, and I'll also do my own orthodontics as well. So throughout dental school, I kind of toyed with the idea of going to surgery or going into orthodontics, but I found that I really love the variety in my day-to-day work. And as a general dentist, I'm able to do a little bit of everything, and really just kind of spices every day, keeps everything varied and exciting. So about my practice, I'm the lead dentist at a dental practice called Innovate Dental. It's in Leicester, Massachusetts, which is an hour outside of Boston. We've focused on high quality, low volume services. So the patients that come in are patients for life, and we really embody the Innovate name, meaning that we have a high emphasis on technology in our office. And as we get started, I'll kind of show you some of the technology that we utilize in our office. Future plans for myself, as I kind of grow in my associateship, I hope to own and operate my own dental practices in the future. And I would like them to also focus on cutting-edge technology, exceptional patient care, and excellent service. So just a few examples of what I do on a day-to-day basis. We do a lot of crowns, so replacing old, worn-down silver fillings on back teeth, replacing them with porcelain crowns that are shown to prolong the life of crowns, reduce the chance of decay. Have a good night. So this is the majority of what I do. We'll also do some aesthetic fillings. So this was a patient that saw me in residency. He's a shift worker, works at a hospital, and after a shift one day, he fell on his face and broke his front tooth. And this filling was something that we were able to do with him in a single visit. It's all made out of filling material. It's all done by hand. And doing something like this just gives you a great, satisfaction for being able to provide services. Because one moment a patient's coming in, he's wearing a mask and he's not willing to smile. And next hour, he's walking out with a whole tooth. And, you can really change someone's day by doing good work. Moving forward, this is another aesthetic case that I did back in dental school. Actually, this was one of the cases that I used to graduate. So this was a patient who had several really broken down stained fillings on his front 4 teeth. We replaced those 4 fillings with new crowns, and you can just see the difference is night and day, and that's my guy. You can see how happy he is with his work. And this is another case. This is an aesthetic bridge that I did for a patient. So this patient came in with missing 2 front teeth, and I think anyone can agree that, a smile is so inherently important to our personality, our self-confidence, the way we feel about ourselves. If any of you were missing your 2 front teeth, it'd be very difficult to smile. It'd be very difficult to, laugh out loud and really show how happy you are without showing your 2 front teeth. And this was a woman who was very vivacious. She was full of life, loved to host parties, had a lot of friends. And the day we first met, she said, she was wearing this partial denture. And a partial denture is, essentially false teeth, something that you take in and out of your mouth. And she hated it. It was loose. It just didn't look good. She said, "Doctor, with my missing front teeth, I don't feel like myself. I don't feel like smiling. I don't feel like seeing my friends. I don't feel like myself." So what we did was an aesthetic bridge for her. So essentially a bridge is several teeth that get bonded to neighboring teeth, and they give the appearance of full teeth. So it's essentially false teeth that instead of getting removed every night and every day, they're cemented in and they don't come out. So you can see what she went from here, and then this is her final picture here. You can tell she looks happy in her before, but look at her in her after. She is glowing. She looks fantastic. And this is the type of work that I love doing as a general dentist. This kind of work that can really change a patient's life is, powerful. It's life changing. So I love doing this kind of work, and this some stuff that you can also do as a general dentist. Some other stuff that I do, we do root canals as well. I'll also place my dental implants. This is another nice technique for restoring or replacing missing teeth. And I'll also do a little bit of orthodontics too. So my orthodontics are mostly limited to clear plastic aligners, so think Invisalign. So this is one of my first patients that I did an Invisalign case. So you can see her before her smile looks okay, but look at her afterwards. Just really awesome stuff. You can really change a patient's perspective on their life. You can change how often they smile. And a lot of studies show that our mood is actually linked to how often we smile. If you're ever feeling down, I think some people say you can, just force yourself to smile, and it'll inherently make you feel happier. And I think that's certainly true. When you don't have a smile that you're proud of, that you're happy with, you don't smile as much, and then you're just not as happy because of your smile. So I think to wrap up some of these cases, as a general dentist, a lot of my work involves around restoring decay in people's mouths, restoring missing teeth, giving them the ability to function, meaning they can chew, they can eat, they can smile. All of these things impact a patient's lifestyle, the things that they eat, the items that they eat, and how often they smile. So all the things that I do on a day-to-day basis really impacts a patient's lifestyle and how they live their lives. So all in all, like I said, it's a great career that impacts our patients and really impacts how they live their day-to-day life. So, a little bit of technology that I want to touch on. It's called CADCAM. So this is something that we use in our office very often. CADCAM stands for Computer Aided Design, Computer Aided Manufacturing. Put simply, it's revolutionized the construction of dental restorations. So previously, when we create a crown, for example, when we make the crown, to take an impression, we use a goopy impression material. It sits on the patient's tooth for about 3 to 4 minutes. We take that impression, we send that to a lab, and then the patient wears a temporary crown for about 3 to 4 weeks. After the 3 to 4 weeks, the lab sends us back a finished crown. Yep, I'll lock up. Thanks, Anna. After the 3 to 4 weeks, the lab sends us back a crown, and then the patient gets their crown. So what this means for the patient is historically, crowns take 2 visits, and they have to wear a plastic temporary crown that's held on with temporary cement. And oftentimes that temporary crown can fall off. Things can get underneath that temporary crown because it's made out of plastic. It's not made out of a long-lasting material. So all in all, it brings down the patient experience. It's less convenient for the patient. It's less pleasant for the patient. And CAD-CAM is something that changes all of that. So instead of doing a goopy impression, we actually take our impressions with a digital camera. It's a digital scanner that goes inside the mouth and makes a digital model. And instead of sending that crown to a lab to do, we do the crown in our office. We have an in-office mill that actually mills the crown from a block of porcelain. And that turns at 3-week to 4-week turnaround time and 2-week visit, or 2-visit appointment to a single appointment. So we're taking that crown that used to take 3 to 4 weeks to get to a patient, we're boiling that down to about 2.5 hours. So it greatly improves the speed of treatment, improves patient satisfaction, and reduces the cost of the treatment because we're not dealing with out-of-party labs. All the work is being done in our own office, so we can actually decrease the price of crowns and other treatments that we make with CAD-CAM. I don't think this video is going to work. I did have an example of how CAD-CAM is done, but that's okay. All right. So now we're getting on to some stuff that I'm sure people are most interested in, especially if you guys are pre-dental students listening to this. How I studied for the DAT. So if you remember back to my GPA from dental school, it was definitely on the lower end. It was below average for normal applicants. I think where I was able to make up for that low GPA was in how I prepared for the DAT and how I scored on the DAT. So from what I remember, I used the DAT boot camp, and the cracked DAT for the PAT session. And I used the DAT Destroyer for organic chemistry, Gen Chem, Bio, QR. I think at that time when I took the exam back in 2014, these were the most recommended items. Things might have changed since then, so I'll definitely double check. But these items were awesome and instrumental in helping me get the score that I get. So just some general study tips: take as many practice exams as possible. I can't stress how long this exam feels when you're actually sitting in the exam room. I've never taken an exam that long other than the SATs. So leading up to the exam, I took one practice exam every weekend to build up my stamina. So by the time the exam day rolled around, I was breezing through it. I had good energy. I didn't feel like I was getting tired. And I think it was really because I warmed up my mental ability to be able to take an exam that long. Second tip I'll give is to set a schedule and stick to it. And that is not only going to incorporate how much time you devote to working on your bio section, how much time you're going to be working on Orgo and PAT. You should also be incorporating rest days, time for exercise, mental health breaks, and especially in the days leading up to the exam. So I think in the days leading up to the exam, it's very, very natural for you to feel that you're behind schedule. You really want to review your SN1, SN2 reactions again. So I think these scheduled break times can kind of go out the window. My best advice is to not let that happen. Really focus and prioritize on your mental health, prioritize rest days and exercise. And, it's just like being in the gym. While you're in the gym, you're putting in work. Where you're actually making your gains, where you're actually making your recovery, is at night when you're sleeping. It's the same exact thing when you're studying for your exam. Going 12 hours a day studying for your exam, skipping your sleep, it's going to be inefficient. It's going to be inefficient studying. So really, really incorporate your rest days, focus on your exercise, stay physically healthy, stay mentally healthy while you're studying. Probably my biggest tip, if I could do one thing differently for studying for the DATs, is I wish I read this book called Deep Work by Cal Newport. I actually picked up this book while I was in dental school, and I was studying for my first year of exams, and first year in dental school is essentially all didactics. So a lot of time reading lecture notes, a lot of time taking exams, and I actually read this book as a guide to help me study more efficiently. I had found some awesome, amazing tips in this book, and I really wish I used it when I studied for the DAT. I think it would have helped me perform even better than I did. It's got a lot of great tips on when you should study, what your study atmosphere, environment should be like, and how you can effectively incorporate rest time into your study. So highly, highly recommend this book, even if it's just a quick breeze through. I think it could benefit you a lot. Okay, so you already took your DATs, you sat through the application, you sat through the interview. Now it's time to pick the right dental school. And this can be a very, very daunting procedure, especially if you're a great candidate and you have a lot of options to choose from. So how do you kind of analyze what the best dental school is, especially when you go onto the website and they're all pretty much saying the same thing? I think there's three things that I would really focus on. Number one is absolutely the clinical experience. How do you quantify your clinical experience? One way to know is looking at the requirements that the school has for the dental school students to graduate to become dentists. It's how many fillings do you need? How many crowns, root canal, extractions, so on and so forth, do you need to complete before this school is willing to say, hey, Dr. Bowen has proved he's proficient and he's ready to become a dentist. Usually, the more requirements the school gives, the better. The more requirements the school gives means that the more patience they also have and the more experience you'll be able to have in dental school, and you'll graduate as a more experienced, more qualified dentists. Another thing that you guys can look out for is to see if they have any additional training. At BU, I was certified in Invisalign, which is fantastic. After I left, they started doing Botox certification. If that's something that you're interested in, that's something to look out for. And CADCAM and digital dentistry. I think CADCAM dentistry is truly the future of dentistry, really revolutionizing how dentistry is performed and how customer service is done. So you can go to a school that has an emphasis on digital dentistry, and I think it only does more to future-proof you as a qualified dentist. Another thing to look out for is postdoctoral specialty programs. So what that means is, does your dental school offer oral surgery? Does it offer orthodontics, periodontics, endodontics? And that can be kind of a double-edged sword if your school does or doesn't offer it. So, for example, if you did want to go into oral surgery at the end of your dental school career, students that go to the dental school generally have an easier time entering their school's postdoc programs. The downside to that is that more of those specialty procedures go to the postdoc students. So at BU, we had oral surgery, we had endodontics, we had periodontics. And what that meant for me as a general dentist, who pretty much knew from the beginning that I didn't want to specialize, what that meant is that all these specialty procedures, the root canals, the third molar extractions, those weren't going to the pre-doctoral students. Those were going to the post-doctoral specialty students. So I didn't feel like I got as much experience in those elements as, say, a student at Toro College who doesn't have any of those specialty programs. And so they're doing all the third molar extractions. They're doing all the tough root canals. Okay, so that's something to look out for. Last couple things: location and tuition. Location, pick somewhere you're going to enjoy staying for 4 years. If you're from California and you know you hate the cold, maybe going to Michigan or Boston is not for you. If you know you want to stay close to family, that's something to consider as well. And at least at BU, I know a lot of my classmates, even though they were from West Coast, Midwest, a lot of them ended up staying in the Northeast after dental school. So also consider that as well. You may like the area so much that you decide to lay down roots and stick around. Last thing, very important, is tuition. Every year, dental schools get more and more and more expensive. And I think it's easy to look at tuition as something that, it's just a ticket that you have to buy to get your education. I think that's true in many regards, but I think it's important to look at what you're actually getting when you pay that tuition. Make sure you're getting an excellent clinical experience that's worth the price. If you have a in-state school that provides a lower tuition for in-state residents, I would highly recommend that. If you were to take out a full scholarship through dental school, all 4 years, the average cost of attendance is around $350,000 to $400,000. And by the time you graduate with interest, that's going to end up being around $400,000 to $450,000, depending on if you want to buy a practice in the future. But these are loans that you're going to be paying off for the next 10, 20, even 30 years. So that's something to strongly consider now, while you still have that option of where you attend school. Okay. Moving on, now that you're in dental school, how to maximize your dental school experience. First and foremost, absolutely build strong relationships. Establish a good network of classmates, upperclassmen, school admin, professors. Be friends with everybody. I think as important as dental school is for establishing your clinical skills, it's also really important to establish how you interact with people. Are you professional? Do you engage your patients in a professional way? Do your patients feel that you're taking good care of them? Do your colleagues feel like you're a good colleague? Are you respectable? these are things that get picked up on very early on in dental school. So I would strongly recommend that you develop these good habits early of building strong relationships, especially after dental school. Now that I found that I'm a practicing dentist, I'm a solo practitioner in my own office. So at times it can feel a little bit lonely being the only dentist in the office, being surrounded by, hygienists, dental assistants, and other auxiliary staff. Sometimes it's hard to find people to discuss cases with or like share your day about. Just having a strong network in dental school can really, really help with that. Next tip, establishing good habits academically, professionally, physically, and mentally. The habits that you start in dental school are the habits that you're going to carry on with you throughout your career as a dentist. So what that means is if you are precise, if you have an excellent attention to detail, if you really care for your patient, these habits are going to last past graduation into your career. But on the flip side, if you like to cut corners, if you are looking for the fastest way to do something, even if it's not benefiting the patient, it's hard to think, I'll just do this now for school, but when I become a dentist, I'll do things differently. It's not really how things work. How you are in dental school is a good indicator of how you are as a dentist. So sometimes the right thing to do is going to be the hard thing to do. The best thing to do is going to be a little bit harder than the easier thing. So I would challenge you to make those hard things and do those hard things until they become easy things. Really establish those good habits early. Another tip, go above and beyond the graduation requirements if possible. So, for example, if your school requires you to do 10 crowns to graduate, do 15, do 20. The more experience that you get in dental school, the better you will be for your future career, at least for the first year in your career. After you graduate from dental school, you will never have the network that you have in dental school, where you can do your work and show a professor right away and get instant feedback. And that feedback can be like that you did something well, but something could be a little bit improved. It's really hard to get that experience once you become a dentist. The only real way to get feedback is just taking photos of your work and just posting it online to a social media group, which is really not the same as getting instantaneous feedback. So maximize your clinical experience by doing as much clinical work as you can in dental school. And of course, enjoy yourself. I think dental school was a very difficult time. It was very challenging, but I think it was one of the most rewarding and most satisfactory times of my life. I learned a lot about myself. I grew a lot as a person. I think, people grow a lot through high school and college, but you haven't seen anything until you've gone to professional school. So be ready for some good changes, get ready for some growth, and really enjoy the ride that you're on while you're there. I've made some lifelong friends in dental school, some friends that, I'm the best man in their wedding. We go on vacations together all around the world now that we're making this dentist money. And, I wouldn't trade it for anything. So as stressful as dental school can be, and as stressful as the application process can be, don't forget to enjoy yourself and smell the roses along the way. Three skills that every great dentist masters. And these three skills, everyone can start working on them right now. The first is manual dexterity. Can't be a great dentist if you don't have good hands. Ways you can start working on that if you're into art, painting, pottery, anything manual, anything where you're trying to create something with your hands is going to be excellent practice. Another great skill is active listening. So active listening is when you actively engage with someone who is speaking. When you really follow what they're saying, understand the complexities of what they're saying, and really understand the emotions behind their words. This goes hand in hand with the next topic about emotional intelligence. So I think being a dentist really belongs in two camps. For one, having great clinical skills will get you very far in your career. If you can produce beautiful crowns, if you can produce great work that people are happy with, that's comfortable, patients are going to come back to you. But if you do all this work and you just can't connect well with your patients, if you don't know how to speak to your patients, if you don't know how to convey that you care to your patients, I think that is a serious handicap for a lot of dentists. And a lot of that comes down to not being able to actively listen and not having that emotional intelligence. So I think an example where I use emotional intelligence every day is where patients will come to me for an exam, and it'll be my first time meeting them, and they'll have these issues in their mouth where they may have cavities, or they're missing teeth, or they have some level of gum disease, and they tell me what they want or what they think they want. I think for the non-emotionally intelligent dentist, it's very easy to treat this almost like a mechanic, as if a car rolled into the shop and just said, oh, you need X, you need Y, you need tires on this, you need a crown on that. But using emotional intelligence and really understanding where your patient is coming from is a powerful weapon to suggesting better treatment that can provide so much more for your patients. And these three skills are something that I would highly recommend that everyone start working on. The better that you master those, the better dentist you will be. I don't know about you guys, but I am a sucker for personal improvement books. These two books I think incredible. First is Atomic Habits. So going back to where I was talking about establishing good habits early on, habits in school, but also habits for gym, for physical exercise, habits with your friends. Atomic Habits talks all about establishing good habits, and I think this is something that's very, very important while you're in professional school. Professional school is 4 years long. It's a long time to suffer through if you have bad habits. Highly recommend Atomic Habits to making better habits and to mixing bad habits. Next book is How to Win Friends and Influence People. A little self-explanatory. This book has been around for almost, I think, 100 years. This book is all about how to engage with people, how to interact with people a little bit more effectively. I think for some people, the information of this book is going to be kind of obvious, a little easy to understand. For someone like me, it did not come easy. So highly, highly recommend this book. I think it's just good stuff, understanding how to interact and understand people in a better, more effective way. And the last parting quote I'll leave with you guys. The dean of my school told this to us on our first day of dental school. He said, the days are long, but the years are short. And having gone through 4 years of dental school, 1 year of residency, 1 year of private practice through COVID, I can certainly say the days feel very, very long, but I can still remember my first day of dental school like it was yesterday. So really enjoy the journey that you're on, even though it may feel like we're just trying to hit milestones and like, oh, once I get into dental school, I can relax, or once I graduate from dental school, I can relax. It's really not the mentality that you want to possess. Life is a journey, and it's important to kind of stop and recognize how far you've come and how far you've let to go. And I think having that kind of positive mindset will really improve your mental game as you're approaching this journey. Okay. And that's me, guys. This is my contact information. You can find me on IG. You can find me on TikTok. My email address is down there. I did one of these shadowing sessions for another group of 4 and picked up some mentees that were really interested in asking questions. I love to mentor. I had some great mentors that helped me along with my process, getting me where I was to where I am today. I'm more than happy to pass the torch. If you have any questions, I would love to answer them. But that's it for me. Thank you, guys.
All right, thank you so much for that amazing presentation, Dr. Zhou. We can now go into the questions portion of this session. So the first question is, you mentioned earlier the CAM sort of new technique. How do you stay up to date with all these current innovating sort of techniques in dentistry? Do you have to attend sessions, or how exactly do you guys do with that?
Yeah, that's an awesome question. So every year, a dentist is required to do a certain number of continuing education hours, and these are typically lectures given by either schools or private organizations that are trying to sell some kind of technology. And there's also annual conferences where dental vendors, dental technology will be looking to show off their latest and greatest innovations. So it's actually a state law or a federal law that you stay up to date with new technology. How you do it is kind of up to you, whether you want to go the route of attending lectures or speaking with salesmen. It's completely up to you.
How many hours would it have to be?
So for me, it's not very much. It's about 12 units, which translates to about 15 hours per year. So it's not very significant at all. I personally go way above that, and I think most dentists, especially when they're young in their career, should do that as well.
Okay. And I know you mentioned like being a super general dentist, you get to do sort of a lot of everything. So when exactly do you decide to sort of refer patients to a specialist versus doing them in-house?
Yeah, that's a fantastic question. So when I look at a case, when you do a case that's typically done by a specialist, a general dentist can do any kind of procedure in dentistry. So a general dentist can take out third molars, they can do implants, they can do complex gum surgeries, as long as they do it at the same level as a specialist. So I'm fairly confident in my root canal abilities. I'm fairly confident in my implants. So I know for the most of those, I'll do them on my own. But if there's a complication, if I see something is going to be a little bit more complex, more tricky, those are the cases I typically refer to a specialist for. I think it's always important to kind of test your comfort level and push yourself to be able to do more, provide more for your patients. But it is also a matter of hubris and humility, understanding your limitations and knowing exactly how much you can do for your patient.
Okay, awesome. Also, you mentioned earlier how it is important to sort of get a good community, like when you get into dental school, like basically become friends with everyone. So in your current office, how do you sort of handle stressful sort of cases? And I know you mentioned you guys have like social media you guys post on to like ask other professionals for help. So how do you personally sort of handle stressful cases?
Yeah, ideally, you would have an older doctor in the office, someone that you can kind of bounce questions off of. It's not the case for me, so I take a lot of the questions that I pick up on a day-to-day basis, and I'll just ask the colleagues that I have from dental school. A lot of my classmates from dental school, they went on to specialties. So they went on to pediatrics. So if I have a child that comes in 9 or 10 years old with, like a bite that I've never seen before, I'll take a quick picture and I'll ask my friend who's now a specialist. Or if I'm trying to get advice on what's the best scanner to buy for my new crowns, I'll post my story and post it to a group that I'm in on Facebook. So I think for me, I honestly prefer having a bigger network rather than asking one individual person in the office. Because I think when you have a single person that you go to for all your questions, you essentially learn how to practice just like that person, which can be good for some things and not so good for other things. So having this variety, having this large community where you can bounce ideas from and hear different ideas, I think it only benefits you and it only benefits the patient.
That is good to know. I guess, do you recommend people to take a gap year between undergrad to dental school, or do you sort of recommend people to go to dental school right away, or what are your thoughts on that?
Yeah, I think the decision to take a gap year or not entirely depends on you and your maturity level after undergrad. So, personal example, I took 2 years off for gap years. And in that time, I was deciding whether or not I wanted to pursue medicine, or if I wanted to go to dentistry, or if I wanted to pursue an entirely different career altogether. So in that time, I became sure that I wanted to do dental school because I had exposure to all these other careers. So I spent a lot of time in hospitals. I spent some time in consulting as well, doing IT, and trying out all these other jobs and understanding that, this isn't it, gave me more confidence that I'm approaching dentistry and that I knew it was the right career path for me. Another thing, everyone graduates college with different maturity levels. I was definitely on the lower maturity level when I graduated dental school. I think my priorities were still much aligned in having fun and partying, which is not a bad thing, but I knew if I went into dental school straight from undergrad, I don't think I would have had the right mindset and I would have had the right priorities. So, honestly, knowing whether to take a gap year or not really requires a good understanding of yourself.
Right, that makes a lot of sense. So did you work at all during dental school? And if not, I guess, how do you recommend people to work during this time?
So I worked in my senior year of dental school. Some people work during dental school, some people don't. The majority of my classmates, they took up, something simple, retail jobs, working in service, hospitality, restaurants, just to kind of, get you some fun money for weekends. I think some of the more driven students and some of the more gunner students were picking up their hygiene lessons or hygiene licenses and doing cleanings on weekends. That's certainly an option too. I don't know how those people do it because I'd be exhausted after 5 days of school and then another day of working 9 to 5 in an office. For me, in my senior year of dental school, I worked at a boutique gym called Barry's Boot Camp, and I made smoothies, which was kind of fun. I learned how to make some bomb smoothies, and I got free gym classes out of it. So, totally up to you whether you decide to work or not.
That's awesome. You became like a smoothie master, huh?
Oh yeah.
Another question is, how different is real world dentistry compared to what you experienced in dental school, during clinics and everything?
That is a fantastic question. I think real world dentistry is very, very different from what you learn in dental school. I think in dental school they teach you the textbook way to do things, the way to do things that's been established by literature, randomized controlled trials. Really the best way, I shouldn't say best way, but just the most proven way to get from A to Z. But in reality, there's many ways to go from A to Z. You can go in a straight line, you can do zigzags, you can go loops. The saying is, there's a lot of ways to skin a cat. I think it's particularly true in dentistry. So in dental school, they'll teach you the most established, the most consistent, the way that works for this dentist that's teaching the course. But after you graduate, you can follow those same procedures, you can follow the same style of dentistry, or you can pick up a different style that works possibly better in your hands. As long as the patient is still getting their ideal outcome, how you get there is completely up to you.
All right, another question is there anything that you wish you had done differently in undergrad to sort of prepare for dental school?
Hmm. Other than having a better GPA, probably not. I was pretty happy with how I spent my undergrad career. I was involved with a few leadership positions, a few social orgs on campus. I think one thing that everyone could probably do is just spend more time at a dental office and understand how dentistry works, and really kind of understanding what's important to remember in dental school and what's, a nice to remember thing rather than a need to remember. So I think the more familiarity you have in before getting into dental school with the field can only benefit you once you're in dental school, because you know exactly how the information you're learning applies. One thing I would strongly recommend before you go into dental school or before you start applying is to make sure you actually would enjoy dentistry. Every year at every dental school, there's always a few students that get into dental school, go halfway, or they even graduate, and then they realize they hate being a dentist. It's a colossal waste of time, a huge waste of money. So if you're at all unsure about becoming a dentist, pump the brakes, don't apply yet, and really make sure you know what you're doing before you jump in.
So after graduating dental school, how difficult is it to get a job after graduating?
Super easy. Super easy. You never hear of dentists that are unemployed. I think it's very easy to find a job. It's a little bit harder to find a very good job. And I think that really depends on what your definition of a good job is. Are you a dentist that wants to work in a high-tech office where you're only seeing a few patients a day and you're doing more expensive and more comprehensive care for your patients? Or do you see yourself working at a office that sees low socioeconomic status patients, where you're doing more basic dentistry, fillings, cleanings, but patients really appreciate your work? Or are you working for a dentist that unfortunately takes advantage of their patients? They're out there. So it is easy to find a job, but it's hard to find a job that really matches your personality, matches your motivation.
So, how do you handle sort of like rude patients or difficult patients?
Yeah, that's a good question also. With rude patients, I think it really depends, because for me as the doctor, I don't have a whole lot of patients that are rude directly to me, but I do have a lot of patients that are rude to, say, the front desk or my assistant, who's a woman. And, it gets it can get difficult at times, because as a business owner, you want to protect your patients. You want to protect their experience, make sure that they're cared for. But above that, you want to show that you're really going out to bat for your team, and that you put your team above everyone else. So for rude patients in general, I'll try to understand if they're, why they're being rude. Are they being rude because of something that my office did? Or are they being rude because they had a bad day? Did someone cut them off on the highway 5 minutes before they came in here? Or are they just being rude for the sake of being rude? So I think understanding why they're being rude is an important part. And if they're being rude for things that are outside of your control, outside the office's control, or if they're being rude for things that are kind of transitory, like something happened to them right before they came in, and they're kind of reflecting it and giving it to you, then we just let it pass. We're very understanding about, human nature. Things happen. But if they're rude, consistently rude, that's when I sit them down. We have a conversation. I tell them, listen, it's come to my attention that the way that you spoke to my assistant yesterday, my assistant didn't appreciate that, and I need my assistant to work for me. I need all my team members to provide the care that we provide. If you ever have an issue with anything, please come find me. If there's anything I can do to make your experience better, come find me. So it's a lot about, kind of softening the blow, but letting the patient know that, hey, I know that you're being rude, and that kind of stuff is not tolerated here.
So would you say like those rude patients are sort of like the most difficult thing about dentistry, or is there something that you think is like the most difficult thing about this sort of career?
I would say there's a lot of difficult things in dentistry. Like any other career, there's a lot of pros and cons. I think difficult patients is something that you'll encounter in a lot of industries. So any realm of healthcare, if you've ever been in the service industry, dentistry is very similar where you'll have unhappy patients or rude patients. I think that's one of the things that make dentistry difficult. For one, dentistry can be pretty taxing on your body, especially when you are kind of sitting over, hunched over. A lot of dentists have neck pain, shoulder pain. They develop eye issues over time. So it is very physically taxing, which kind of goes back to my lecture on how important it is to establish good physical exercise early on to prevent any kind of work-related injury. And I think it is a very stressful job. I think dentistry can take a lot on the individual dentist because dentistry is a very personal kind of job. There's nothing more personal than someone's mouth, and that trust where a patient is trusting you to go inside one of the most personal parts of their body and do kind of maintenance work that makes them better. It's a lot of pressure on dentists, and when we fail to live up to that kind of expectation, that kind of trust, it really affects us because it doesn't just feel like, oh, I did a bad filling today. It feels like I'm a bad dentist. And it doesn't feel that way in some other industries. Or, if you're, say, a software engineer and you wrote a bad piece of code, it's like, oops, I just wrote a bad piece of code. But because dentistry is so personal and so direct from person to person, providing a bad experience can be very impactful on your own personal well-being. So I think that's something else that can make dentistry quite difficult.
And for the last question, did you wish sort of dental school sort of taught you something or prepared you something in your field? Like you mentioned, like it's difficult to deal with rude patients. Like, is there something that other than rude patients that you wish sort of dental school taught you?
Yeah, absolutely. I think dental schools will really vary across the board on these kind of extra things that they teach you. At the core level, all dental schools, they need to teach you how to do fillings. They need to teach you how to do crowns, how to do a basic root canal, how to take out teeth. A lot of these basic clinical things are required by dental school to do. Some schools do it better, some schools do it worse. But the accessory things, I think that's where I find a lot of value. So my school did a great job on teaching patient communication, how to effectively interact with patients, especially rude patients. One thing I wish my dental school did better at is providing a better understanding of business management, knowing how to run a dental practice. It makes sense that not all dental schools will provide this kind of course because not all dental students are interested in owning their own practice. And doing a full business course is probably going to add like an extra year to your dental school, or at least 6 months. It's not something that you can boil down into like a 2-week seminar. But I think that's one thing that I wish my school trained more on is just how to effectively run a business, how to effectively run a practice.
All right, thank you so much, Dr. Zhou, for all the advice and all your insight on everything. It was very informational, and thank you everyone for tuning in for today's session. Just a reminder, you have to take the quiz in order to receive the credit after this video, and we are going to end the session now. Thank you so much, everyone.
Thank you guys. Have a good night.